It's very, very clear that non-medical, social, and economic disparities drive health outcomes. The respondents in the poll know this, okay? This audience knows this. Anna Beer knows this when she relates that, and we really have to start responding to what we know here. In my hometown, I grew up in Washington, D.C. We've been there for multiple generations, and we use the Metro to get around town, and I'm sure some of you have seen the Metro map. Well, I have a replica of that map in my office that's in the RWJF Commission to Build a Healthier America report. And in that one depiction, it shows that where you get off, what stop you use on the Metro, you can show what the life expectancy is in that particular area, in that community. And DC is really not that large. If you live in the inner loop of the Beltway, then chances are your life expectancy is lower than if you live in one of the outer loops going out towards Maryland or towards Virginia. And so if a child is growing up in an environment that has high stress, high trauma, that if she is more likely to have some illnesses in her adult life that she probably wouldn't have to suffer from if that wasn't the case. If she grows up in a community or a neighborhood where there isn't access to quality health care, where the education system isn't supporting her in the ways that it should, if her family doesn't have access to healthy foods, fresh fruits and vegetables and otherwise in her life, she's going to have more complications, and these things are all socially determined. If the housing system is poor, if the neighborhood is a polluted neighborhood, if all these different things that we all see in our everyday lives that are part of our social environment, these things are actually driving health outcomes to a great deal and great extent.